How does Ergotron fit into and perhaps enhance a given healthcare workflow?
So that, and you come back to workflow, and that's kind of at the core of what we're looking for there. So really our goal is for our solutions to allow the caregiver to position the technology to best support whatever that workflow is. So our goal is to support what we call the physical triangle of care between the patient, the caregiver, and the technology. And so that's really at the core so that it keeps the patient experience at the center of care. But it also then makes the computer access needed to support that workflow as efficient as possible. So not only for that workflow, but the overall care process. But back to safety, another aspect of that's the ergonomic adjustability it provides, so that given the clinicians that are, as we all know, often work long hours and overworked, our solutions provide ergonomic adjustability so that we can ease that stress as they go about their workflow. So there's kind of that practical implementation around the triangle of care, but then what are we doing to help support the caregiver to make their daily lives easier?
Well, I guess another way to look at it is that I'll tell you what we don't want to be. we don't want to be an impediment, right? We don't want to be the thing that slows a clinician down or makes a clinician uncomfortable or makes them less efficient or productive. So, just I think Dick summed it up nicely. I think that we ultimately want our product to kind of just like disappear into the wings. If they're talking about our product too much, it's probably not a good sign. I like to describe it to people who know nothing about what we do as we're kind of like the delivery vehicle, literally and figuratively, for the technology. So we're the ones bringing that technology to the point of need, which in some cases in healthcare can be, right there at the patient bedside. In other instances, it's at the desk of the AP clerk or the CNO, or sometimes it's the laboratory, sometimes it's the pathologist in the grossing room. We're bringing that technology to the point of need. And I think one of the, kind of going back to the value that Ergotron offers is, being able to provide the flexibility to adapt our products to those different workflows is pretty important. So, we kind of have our core product families, but within each one of those, you can customize them and tailor them based on those specific workflow needs. So if there are specific peripherals that are required in one workflow, but not in another, you're not stuck with, a one size, again, kind of that one size fits all sort of mentality.
All right. Let the workflow, right? Is how you assist the workflow. So, Aline, if you might, so if you put the shoes of a partner on for a moment, and if you were engaging with an end user, what sort of probing questions do you think are useful for a partner to ask, right, to maybe open up some of these sales opportunities?
So, I think some of this is sales 101, right? But what are your priorities? What are you focused on? What challenges are you facing as a result of COVID? What's a really difficult workflow problem that you're trying to solve, and how can I help, right? I think all of those things sort of start the conversation, but and you're going to get a myriad of answers, I would expect, when you ask a hospital those questions, because everybody's facing different challenges. Some of them are facing all the same challenges. Obviously, everybody's dealing with COVID, everybody's dealing with budget cuts, all that stuff. But trying to get at the specific workflow needs and maybe gaps for them is where the partner, and where we try to find add value is what's that one thing that you just haven't been able to solve for. And can we solve for it? So we spend a lot of time doing walkthroughs with clients. And I just wanted to add, this kind of dovetails back to what Dick was saying about the clinical showroom, but the partners don't need to be experts on our products. There's just no way that they could be. It's complicated. It's kind of a long sales cycle. Again, there's hundreds and hundreds of SKUs and lots of different ways that you can position, build a solution. So to that end, I think the biggest thing is for them to make sure that they engage us so that we can help them ask those questions and we can help them with the workflow assessment or the walkthrough. Because it can be a little overwhelming to try to go out there and do that yourself.
I think one thing, and this is just a little bit of a deviation on something that Aline said, but given the opportunity to talk to the caregivers themselves, which is ideal, and sometimes coming in the front door right off, you may not have that opportunity, but even a nurse manager, wherever that kind of guides that need, asking them for the pain point in their current workflow, especially as it involves technology access. We're in a mode now where they have a workflow established. There are solutions in place, and many times they've been using that for some time. Is it working for them? And if not, what is it? What is the impediment? Because that's the other thing we're looking for, is to remove constraints. That's part of our overall vision as a company. And so in healthcare, that can be one of the things. And it sounds kind of simple, but nurses are typically very vocal. They're willing to share that with you, but that can be insightful. Maybe the solution should be wall-mounted versus mobile, or vice versa, or the solution they have doesn't provide the articulation they need. Again, going back to that triangle of care to create that, forces them to have their back to the patient. That can be awkward for them, and also diminishes the patient's experience. So hitting on those things then can uncover, potential opportunity for our product. And the breadth of solutions, while Aline mentioned, can be kind of overwhelming. It's also one of our strengths, and we really focus on, providing a solution for a given situation, rather than here's a product that we're trying to force into the application like a square peg in a round hole. So.
Just thought I'd ask if there are any use cases that are sort of success stories in the healthcare space for Ergotron that you'd want to mention.
I think that we've been able to excel here recently in putting together effective solutions for registration workflows, being able to add multiple peripherals to a mobile cart. It's something that, when we designed our carts, and probably most of our competitors, we kind of never dreamed that somebody would want to put all of these things onto one cart. And I'll spare you all the details, but it's like a ton of different peripherals that they want to have with them, that they want to push all over a hospital 24 hours a day. Being able to solve for that kind of tricky or niche-y workflow feels good, right? We recently had we won a very, very large system-wide cart standard that was born from a desire to solve for a registration workflow. And it was kind of interesting because we didn't know that we were competing for the broader business at the time. We thought we were just competing for the registration cart business, but because we were able to solve that problem, we demonstrated our value, not only for that specific project, but as an organization, and therefore kind of were, very pleasantly surprised by the fact that meant we were going to get a lot of follow-on business. So I think that was an interesting story, and kind of
is interesting. So how many devices would you say connected to a cart? Like 10 or something like that, or?
It's like 4 AC powered devices.
Okay.
So between your monitor, your PC, your now I'm drawing a blank. So you have an AC powered document scanner. You have a monitor. You have a PC, and then there's a fourth thing, and I'm trying to remember what it typically is.
So they came up, they're just adding things to their solution desk.
And then there's also multiple USB
to keep it mobile.
Yeah, multiple USB peripherals. So a credit card reader, a signature pad, sometimes a tablet. Like there's all these other things that they want to have with them on that cart, and it just starts to get really unwieldy, and so that we solved.
Found a way to make it work.
Yeah.
Yeah, no, it's a great example.